edition of SPRY webinar. Today, we are honored to have Dr. Tom Porter and Mr. Brady Jacobs from Westarm Physical Therapy join us for the webinar that is titled Why the Best Clinical Directors Are Betting on Innovation Now. So without any further ado, allow me to introduce these two wonderful gentlemen, and then we will go from there. So first, I would like to introduce Brady. Mr. Brady Jacobs serves as a vice president of Westarm Physical Therapy, family-owned physical therapy provider in Western Pennsylvania that offers both outpatient and home health clinical services. Under his leadership, Westarm has implemented key operational improvements, including the rollout of SPRY system and clinical billing teams. Brady is passionate about combining patient-centered care with forward-thinking administrative solutions to improve both clinical outcomes and efficiency. Brady earned his Master's of Science in Health Service Administration from Indiana University of Pennsylvania, and his bachelor's degree is from University of Miami in Business Administration. And Tom Porter is a Director of Therapy Services at Westarm Physical Therapy. Tom earned his Bachelor's of Health Science degree and Master's of Physical Therapy degree from St. Francis University of Loretto, Pennsylvania in 2001. He began working at Westarm in 2001 at the Lower Burrell facility. He became facility director in 2004 and since then has advanced to become the Director of Therapy Services at Westarm Physical Therapy and Administrator of Westarm Home Health. Tom resides in Plum, Pennsylvania with his wife Tara, and who's also a physical therapist. He has 3 children and is very active in Plum soccer and basketball organizations. So without any further ado, gentlemen, thank you and welcome to our webinar.
Thank you.
Thanks, Alex.
Really exciting to have both of you, and I think we've already had multiple conversations, and I think it's so great to have both of you talk about the leadership and the steps and the growth opportunities that you have faced. And I think without saying anything else, I want to say that Westarm Physical Therapy has been leading the field of allied health services and physical therapy for over 42 years, which in physical therapy world, right, that there's just very few legacy systems that are able to not just survive, but thrive for that duration of time. First, I would like to ask the question for Tom, because you've been a leader of clinical care and a provider at Westarm Physical Therapy for over 20 years, and you have been a director for 15 of those years. So in those 15 years, where have you seen the biggest change, and what has running clinic over 15 years taught you?
Well, thanks again for having us. I think the best thing to know is physical therapists are always the constant. We have clinicians from new graduates to some that have practiced over 40 years. And that constant of always want to provide good patient care, good clinical care, really has never changed over that time. What has changed is those challenges. I remember copays the first time I had a patient with a $5 copay, and I couldn't believe that, and how that's now progressed to hundreds of dollars sometimes. The insurance authorization process, insurances, has really changed, where now verifications and insurance is dictating that. And then I think one of the biggest things to change is also the patient expectations. Patients want care now. They want to feel better after that first visit. And they are not patient in terms of waiting for appointments or even getting the care they need. And as they have a lot more money invested into therapy, their expectations are definitely demanding. And then the last thing that's also changed is with the movement towards the PT doctorate program, student loans have increased, and salary demand has increased. New grads coming out with huge loan payments has really put a burden on the providers.
Yeah, absolutely. It seems like a tension point between a higher burden of financial responsibility by patients and also a higher burden of student loan responsibility by providers. And here you are as a clinic director having to deal with both sides and trying to appease and trying to create the highest level of performance and highest level of deliverables on both sides. So that has been a pretty common tension point, and I think you guys have resolved it really well, which leads us to really the next topic of conversation, which is that evolution of electronic medical records and the evolution of EMR. How would you describe the transition from a traditional paper-based EMR to a more of an antiquated EMR system to a more of a modern EMR system? And what were some of the steps over the last 15 years that you have seen?
Yeah. Well, I started at Westarm 24 years ago, and the number one thing we did was write out notes, which sometimes were not detailed at all. You could just put treatment as prior. And we would dictate notes in terms of evaluations and progress notes to doctors. The number one thing for office assistants and our front office staff was how fast can they type, because we were dictating and they were going to be able up front and type them. I would say about 2006 or 2007, I felt like we were one of the first clinics to actually adopt an EMR system, where we were first pioneering getting laptop computers for all the clinicians, which, that was a huge step at that time. And I would still think there's some providers out there that are still doing paper-based charts and everything. And then we changed from that EMR system into EMR system that was great for documentation, and then it was a separate system for billing. So there was no bridge between the documenting, putting the charges, and billing. So the office assistants almost became that bridge where they were, verifying insurances, looking at the insurances, what will they cover or not, and almost screening those charges for that. And then over time, we adopted a system that did have everything together and bridge, but it just eventually didn't have that technological needs that we see coming as we did back in 2006 or 7 when, EMRs first started.
Yeah. And I would like to actually get Brady, like some of your feedback too. So being an administrator and running this large successful legacy business, I mean, what are some of the things that you are seeing with this evolution of EMR, and how are you just getting through some of these, both the positive changes, but also some of the difficulties of transitioning from system to system? So what kind of I guess a sense are you getting, and what would be like in the idealized world of this transition, and what it would look like?
Well, I mean, Tom's a little bit older than myself, so I haven't really been around for, paper charts or early days of EMRs. But, since my time here, I've now been through two transitions of EMRs, and I guess, probably the big takeaway is that it's never going to be easy, and there's always going to be struggles. And yeah, there's going to be people who are not fans of it, staff members that you're going to have to coach through and give extra time to and give extra help. And you're going to have to lead, sometimes get your hands dirty.
Yeah, absolutely. And I think part of this leadership, I think, Brady, that you have exemplified is that the communication and having the highest forms of communication. So you have been I think, stepping into the role of vice president, and again, seeing this organization where you have two types of deliverables. You have a legacy outpatient service, and then you have a home health arm. What stood out to you as the biggest operational challenge that Westarm is facing since your acceptance of the new role?
I just think a lot of our processes and our technology were, we needed modernization of those. Yeah, I mean, even though we weren't writing paper notes anymore, when I first got here, we were, taking patient information, writing it down on a piece of paper, faxing that paper to our corporate office, then typing that information into a Microsoft Word document, and then either printing that and faxing it back, or emailing it and then typing it back into the EMR. And it was just like a multiple step process. And this is just, it's inefficient. It takes up time, and it gives a lot of opportunities for errors as well. I recognize that we needed to be more efficient and to use technology to save time and reduce errors and just become a leaner corporation that can handle, that can utilize technology and adapt to the modern world.
Yeah, I think the human errors, right, a lot of times are the biggest culprit of these sludge points, these friction points, and the more hands that touch any point of clinical documentation, that the higher the likelihood that there's going to be an error present. So I think the more technology can be built to reduce these human touch points, and the more automated some of these steps can be, the better it is. So with this, I think it's really important. I want to highlight one key feature from your organization, from Westarm, that I find truly impressive. So being a physical therapist for over 22 years and having been a part of multiple organizations, I have yet to come across an organization like Westarm that does such an exemplary job of both integrating and using patient-reported outcome measures through their traditional clinical workflow, which both every step of the operation and every clinician both utilizes it clinically and operationalizes the outcome data for their clinical decision tree. So the question here is that how have these patient-reported outcome measures, and this question is for Tom, I'm sorry, how have these patient-reported outcome measures impacted the practice? What were some of the thoughts behind this really exemplary integration of outcome measures into the clinical practice? And what have you learned from this integration?
Yeah, I think, any type of outcome where a patient can kind of buy into their plan of care and their care. So we definitely try to do outcome measures, at the initial evaluation, and through the progress of treatment, and then at the end of treatment with them. So I think that's the biggest thing, is just involving the patient, collecting objective data. Now, we have clinicians years ago would read every outcome measure, every line to the patients. And, that's a huge waste of time in my mind, whereas now we could adapt that technology of outcome measures.
Awesome. Yeah, that's really great. And I think, again, the entire country, and then seeing clinics from East Coast to West Coast, there's just a poor adoption of outcome measures on every side. And I think there's no way to run a value-focused operation like yours without getting outcome measures as an integral part of healthcare deliverables. So this question is actually for both of you, and I want each one of you to take a stab at this. But at what point did you realize that change is necessary? And this relates more than just integrating like a advanced EMR system into your organization. But at what point did you see that adding technology and digitizing your practice, it was a necessary step in bringing your practice up to date?
I just, from my perspective, years ago, to even collect patient emails was a process. We went from 5% collection rates to maybe 70%. And we did a lot with those. As time now changes, 5 years ago, we tried to adopt a initial questionnaire that was a separate provider and try to tie into our documentation system. And just the cumbersomeness of that, where nothing is together, where clinicians still have to transcribe that data into their own initial eval and everything. So that created, I think, our need to know that we need technology that's not only there to move forward in the future. I mean, there's things we may not adapt till 5 or 6 years down the road, but knowing that we can lay that ground floor and then also move towards that adoption of technology, so we're not behind in years to come.
Yeah, I guess my thoughts on that is that change is always necessary, and probably day one of my time at Westarm, I know that change is necessary. My dad says it well. He's always says, if you're not moving forward, you're moving backwards. And I think it's good in that, like, yeah, as a business, especially in today's world where change happens all the time, and it happens at a crazy rate. And if you don't get on that wave, like, you're going to get left behind. So you always have to look for points to change and things to improve on. And think that just as a, someone wants to run a successful company, that's the way you have to do that.
Rather than fighting change, being a part of this change, right? And actually being that point of focus for you yourself. As the quote says, first we made technology and that technology made us. So being a part of this change actually helps us shape who we are and provide probably much better, more efficient quality of service. So let's take a step back a little and talk a little bit about the pain points specific to how we used to be. And first, I will ask Tom about the clinical care delivery, and more from the standpoint of being a physical therapist, being a clinician. So what have you seen as the biggest frustrations as a clinician, as a director, 24 years ago when you started practicing, and how have those changes and evolved into the present day, and how do you see this being manifested through the current systems, through the payers, through the providers, through that cost of care that is both disproportionately large and unfortunately doesn't always allow proper access to clinical services? So how would you reflect on that?
Well, I think as physical therapists, we all just want to do our job, treat patients, and kind of be done with everything. We don't know every insurance role. We don't know everything in terms of, what they're going to pay for, what they're not going to pay for. But the biggest waste of time has always been patients coming in for their initial paperwork or sitting down. Sometimes it might take them a half hour to fill it out, and now that clinician is behind. And it's a waste of time sometimes for the office assistants to go there and assist the patient in that initial paperwork. The second was our verification process. We would, take an intake, ask for insurance numbers, write it down, send that to our billing team. They would call and verify insurance. They would then send it back for that patient's first visit. And we've definitely adopted changes utilizing technology out there now and growing with that. And then the last thing is just those insurance rules for clinicians to know, I can't bill this or that it alerts them if they have something where, they build a type of procedure, something that may not be the most appropriate for that patient, or just knowing that the insurance may not pay for that. So,
it's like absolutely operational complexity, right? It just keep evolving and keeps getting more and more complex. So with the same question then to Brady, how have you seen the complexity change over time since you started the administrative role? And how do you see what are the best steps of navigating some of this complexity that's just evolving?
Yeah, I mean, in terms of the billing side, like obviously just there's so many layers and rules and payers that you can't keep up on it. I mean, you can do your best and you have to have people who know what they're doing, on the back end. But I think really, probably the best way to get ahead of that is exactly that, to get ahead of it and make sure you have a system that you are preventing clinicians from doing, billing things that are going to cause denials and errors before they can even select those codes. If you have rules that in place and a system that basically just prevents errors before they happen, that it saves a lot of time on everyone's part.
Yeah, it's creating an atmosphere, creating a landscape for your therapist and for your clinical staff to operate at the top of their license, right? So like being an administrator, you want to create a landscape for your team to do what they do. And I think as Tom was saying that like we're just therapists, we want to provide the highest quality of care to our patients. And a lot of it has to do with how we can set up our environment, set up our workflow. Tom, this one is for you then. As a physical therapist leader, how do you see the system, some of the antiquated system? How did it hold our clinical delivery back? And how do you see that change impacting it positively? But also, what were some of the friction points? I think we'll touch on it a little bit later on too. But it's not always a smooth transition, right? When you go from a system to a system. So we have this old system in a way that we adjust to, like as clinicians, right? We get used of using the same redundant processes, even if they're inefficient. We still get comfortable with it, and then you just ram the new system in, and not everybody absorbed it the same way. So how you as a clinician and as a leader were impacted by the old system, and how were you able to integrate the new system through these sometimes frictionful points?
Yeah, I think you know what you want in the future, but sometimes you don't have all those options available and you're pulling. So it's not so much the change, it's the process and what processes you have to go through to get to that. And I think we decided to change just because we knew getting on the technology floor. I mean, there's a lot of systems out there that offer the same things that some old systems open, but knowing where the future could be, where we want to move towards, is very important to us. And I think just saving clinicians time with paperwork, with outcomes, with patient portals now that we can do, those are things that are very important to us. I just learned that 50% of our patients are now in the clinic doing digital outcomes or digital intakes. We give them a tablet or they do it at home via email. And I think just from a patient perspective and customer service perspective, patients don't want to sit in and fill out paperwork. They want to kind of do it when they have a chance. They want to schedule their appointments when they could do it on their own time. I love the fact that I could on my phone, any doctors I go into now, answer all the initial pay my copay, do everything, and then I walk in and they say, "Oh, great, everything's done," and then you go and get about your business. So I think that's where everything is moving towards, but it's slow. I mean, process is always going to be slow and change is always going to be slow. And you have clinicians back here still trying to do things an old way and clinicians that have adapted that. So just knowing that we have to buy in as a company and just support those clinicians and help move everybody along in the process is important to us.
Yeah, absolutely. So I'll move a little bit off script, and I think to build on that, we know that it's just really difficult to find a physical therapist or allied health professional to hire, right? The hiring has really been a challenge to a lot of clinics, and I know that at least regionally, that in Midwest, we like that most clinics, I think by some survey, 90% of clinics are understaffed because there's just not enough therapists in the market. How do you see some of this technology that's available as to serving as a differentiator that highlights your practice as something that's a little bit more appealing for staff, for clinicians to join? And what are some of the steps of promoting the technology that's available to attract more talent? And first, I think to Tom and then Brady also, that would be great.
I think it still comes down to customer service. If therapists can provide quality care and even manual therapy, we try to have manual therapy provided on every patient. And what that is time. So if your time is focused on other things like long evaluations, documenting, waiting for a patient in the front, that's taking away from your time where as clinicians, we all just care about the patient and want to get them better and provide quality care. So I think it's more of allowing those direct time with patients, and that sells itself. When honestly, we have clinicians that have been in our company 35 years, 30 years. I've been here 24. And I think that all just says to those clinicians have adapted over time, but we as the company have supported them and just allowed them to focus on patient care. And technology is great, but if you're not focusing on that patient care, you're going to lose clinicians. They're going to feel like they're running patients through the gamut and doing the same things. So I think this just allows them to have the technology available is going to allow them time to do what they ultimately, want to do is just spend it with patients.
Absolutely. And Brady, with the same context, how do you see some of these systems impacting the operational side? So the impact, how do the higher level of visibility, higher level of business intelligence, how does it help serve you and your administrative role? So both from the standpoint of being able to forecast, but also being able to track some of the deliverables based on the new systems.
I think it just comes down to, creating a way to be proactive and not reactive. I think a lot of times you run into problems and with old systems, and you're looking at data from, months ago, and you're not really, maybe not seeing trends happen right away, and you're not able to stay on top of it. And it's just, you need that insight, current insight that really allows you to stop issues before they pile up, because they will. And going months without recognizing a problem, leads to a lot of lost revenue. And the sooner you catch it, the better that you'll, the easier your job will be, and the less revenue you're going to lose.
Yeah, I think in a traditional sense, right? When we as a healthcare system, like just healthcare in general, when we operate on a 30% profit margin, we can afford to be a little bit more loose with lost revenue. But when the margins start to shrink because things become more expensive, the stuff becomes more expensive, the reimbursement is down, right? We have to be very specific about how we manage our revenue cycle, the operational efficiency. So can you, Brady, comment a little bit on whether these systems, both existing systems, or whether you see how these systems in the future can help impact a higher level of efficiency of collections and like getting paid for what we do, getting paid for what Tom and his clinical team does more fairly, right? How do you see the systems impacting that?
I think one thing about SPRY is that, like, we've switched to it, and we, there's, I guess in previous systems, like I learned to read data and find reports, and a lot of times it was, sometimes the actual useful information would have to be manually mashed up into some spreadsheets, by myself, just pulling this information from this report, and then, using this line from this report and comparing it. And it was a large process. And then, I'd find the time every 3 or 6 months to do that. And I think maybe what is promising with SPRY is that, like, I've sent these reports to our success manager, and it's like, hey, here's the steps I take, and here's what I pull, and this is the information that I get from this. And it's like, oh no, we can automate this and make an actual report of it, that I could just access with one click, and set a date range, and that saves me a lot of time, and that allows me to get ahead. And yeah, I mean, I think, that's one good thing about SPRY is that, like, we do have the ability, and SPRY is there to help create that.
So that's creating efficiencies, right? And then just working with the system. I think that any system from the get-go is like this clay, and then we in the clinic start to mold this clay into the type of the system that we need. So I think then for the next question, walk us and walk the audience through some of the steps of the selection. I think we know that, like, that there's a proliferation of these like smart systems out there, right? And there's a proliferation of the systems that are marketing to the allied health community. So what were some of the steps in your selection cycle, both on the clinical side, Tom, but then on the operational side, Brady, that led you through, and what were some of the key decisions that needed to be made when you were making this choice?
On the clinical side, the first thing is just efficiency and looking at the front end, the front office, and we could do verifications now instantaneously for a good percentage of insurances. So that saved us money in terms of sending up our billing team, them doing verifications. Now the patient shows up and we pretty much can verify that insurance. The patient portal, something where we are probably antiquated, having patients fill out their initial questionnaire and do outcome measures. And now we're on having the technology for that. Moving towards credit cards on file in the future, just for patient copays and balances, is something we want to move towards. And then just, now we use tablets in the clinic and that technology. So why we decided that from a clinical end is there's very hard to find services that include all that all in one, and kind of others that, have what you want, don't have what you want. They're still based upon, a platform that might have been out there 10, 15 years ago. And then the move to artificial intelligence, I know that's going to be something that is going to keep building and growing, and just having that ability. It's like we mentioned, it's hard to get clinicians to buy into things, but I know, 3, 4, 5 years down the line, that's going to be something that's just part of the daily process.
When
Yeah, sorry, if you want.
I'll go ahead, Brady. I was going to say that on the operational side, the same question.
Yeah, I mean, I think some of our, decision-making process was, I mean, I definitely took meetings with numerous platforms, and there was a lot of positives and negatives that I saw out there, and a lot of them kind of were the same product, kind of packaged a little bit differently. But yeah, I wanted something that just was able to grow with technology, and had the potential to, make everything in our company more efficient, from the billing side and the clinical side. And myself and Tom, we kind of do share duties in a way, but also Tom runs the clinical side of our team, and I do more administrative type management. But SPRY was one we both agreed on that did have that potential. And yeah, I mean, that's
No, it's awesome, and I think that's a perfect seg into the next question, right? Where I think the expectation and the idealistic view of the transitioning to a new system is that it's just the seamless transition where you wake up on Monday and the new system is on and everything works effortlessly, and like things are exactly what they're supposed to be. And then there's reality, right? And I think not all rollouts go perfectly, and you guys have experienced some of the hiccups along the way too. So I think some of the best partnerships are made through these challenges. So if you guys can discuss some of these challenges along the way, and also like how does having 24-hour available customer service, how does having some of the channels of communication and open channels of communication, how does that help overcome some of these friction points?
Yeah. Physical therapists are creatures of habit. I mean, we all want to do the same thing almost over and over. And with anything in business or in clinicians, anytime you introduce change, it's a huge item because they sometimes want things the way they were doing it before already. I just want to do it the same way I was doing it. So we probably should have involved our clinicians earlier on in the process, but I'm also concerned with 30 clinicians giving 30 different opinions in the process of how things are. So that's the positive of SPRY, is that customization. But the negative is it takes longer to customize things the exact way not only you want, but to make everyone happy with that. But the process, we've been through EMRs before. It is always, you have some people lagging behind you, some people adapting technology, and you're just continuing to try to focus on the positives and moving forward with that.
And Brady, some of the same questions, some of the imperfections, from your operational side, how do you see them coming about, and how do you see them being managed, and also lessons learned, so that the audience who is looking at this, I think that any system that promises a 100% seamless integration is probably not being fully transparent with a customer, because there's always going to be some bumps along the way. But as long as you understand 6 months down the road, a year down the road, and as long as you understand the journey that you're trying to go through to get this product to be shaped for what it is, it gets there. So what were some of your experiences in integration?
Wasn't easy. Yeah, I mean there's numerous challenges, and sometimes it feels like you're plugging a hole with one hand, and you notice another hole. You plug it with the other hand, and then now there's a third hole, and you don't have any more hands to plug the holes with. But yeah, I mean, getting through that feeling of just sometimes you're in the muck, and there's problems, and you're gonna have to just do your best and keep communication open, and to make sure you're talking to your team and listening to them, and learning about the challenges they're facing, and trying to find solutions with not just internally, but also with the success operations at SPRY or at the EMR, and yeah, I mean it's better to do it with a partner, and SPRY has certainly done their best to listen to us and help us along the way, and make our modifications and make our lives easier. And sometimes it doesn't feel like you want things to be fixed right away, and it's probably unreasonable of outlook to have. Just the way technology is, and humans who you can't do everything all at once. So it's as long as you're looking down the road, and it's you have someone there who's going to help you. You as long as keep your team with a positive outlook as much as possible, and remind them this is not going to be forever.
Yeah. When you're shaping this clay, right? Like we're shaping this clay vase, you don't want too many hands in it because it just rounds them out, but you don't want to also be the only one shaping it, right? So it's kind of like you want just the right amount of hands that can shape it into the structure that you were trying to let it be. So I would want to comment both on a personal side, but I think both of you are showing exemplary leadership, both as professionals, but also as leaders in the community, because communication is hard, and being able to be resilient through some of these bumps in the road, it is also difficult. And you guys have been absolutely the best communicators. And I think it's reflected both on the quality of care you provide, on the resilience of your operation, that Westarm has been leader in the community for 42 years. If I remember reading on your website that you won multiple awards, both state awards and national awards, that's like these awards are not for nothing, right? It shows that you have leadership on every level of operation. You have clinical leadership, you have operation leadership, and I think your community is lucky to have your organization provide care for them. So thank you for that, and thank you for being open communicators. So like same analogy of shaping the vase, like from clay. I think what were some of the points of communication? How do you introduce some of this change to your staff, Tom? And what are some of the points of receiving feedback from your staff, and right, creating the both the equal point of being an open communicator, but at the same time, what your vision is, and you're the leader, and so how do you get others to respond to your leadership? So
yeah, I think getting people to buy in, we're still getting that feeling, but just continuing to have open communication. We've learned various ways, team meetings where people give examples, doing select groups. Hey, how do you want a knee eval, to be? But only having a select group, and assigning others that are involved in pelvic floor. How do you want your questionnaire to be? So I think involving clinicians is the key to getting them to buy in. And the best thing with SPRY right now is the Slack channel, where I can monitor 24 hours a day whatever concern a staff member has. They put it on there, and it's answered timely, and then I could see the results of those, and I could add my input also. So it's just this open form of communication. I have it on, it's an app on my phone. I could just, look at it every day, the notification, somebody has a problem. And then I could kind of summarize all those. And if it's happening over multiple clinics, we can devise the best solution for that and involve staff in that. Or if it's something with just educating a staff member, I could call them personally and educate them on. So that's the number one selling point that we looked at and that we're receiving. It's in terms of that customer service response rate. Everybody says they have customer service, but again, today's age, everybody wants answers now and wants to know something's being addressed. And I think that gives us that. Our staff probably doesn't know how much Brady and I are involved in that process of just monitoring their concerns with everything.
Yeah, absolutely. I think it's like getting that that worldview, and from the point of leadership, actually understanding every nuance, right? I think the staff a lot of times sees the world from a little bit more narrow worldview because their primary responsibility is to provide exemplary care. But when you are a clinical lead or when you are a vice president of operations, like you have a much larger ecosystem you're trying to manage. So you have more than one plate that you're trying to keep spinning without dropping it. So it's not an easy feat and it's not an easy process. And again, you guys are managing it with the highest remarks. So I will ask this question for Brady, and like right now, what has changed after switching operationally? Like I know you reflected that the reports are now more customizable. You can get reports based on dates. What other things have you seen change in your operation, and how do you find that to be helpful to your clinical operation?
I think if you asked me this in 6 months, I'd probably have a more rosy outlook, but I think what has changed is that we have maybe a more real-time look at how our performance has been. I mean, and I think we're able to with at least with our billing staff, like react to denials and rejections, and I think we've in reality, like when you're switching an EMR, you're kind of ditching a lot of old processes. You're saying like, this is how we used to do things, and we're you cut ties with all that whenever you switch to an EMR. You almost have to reform all of these processes, and that's going to take a while. And so like, I mean, our 6 months, 7 months in, like we're probably at a point where our processes have come back around to like, oh, this is how we do things now. So just like learning that, relearning all those, and maybe making them better, and it kind of gives you an opportunity to like, do we really need to be doing this the way we used to do it? And oftentimes the answer is no, or you can make it better.
Yeah, awesome. And definitely, right. It is a journey, and I think it's a journey that only true leadership can see the destination, and like don't start a journey without an end in sight. And I think you guys are doing a remarkable job getting to that point. So then I want to ask Tom a question, and that question is more about the advice you would give to someone else who is in your position, who is a successful clinical leader of a successful allied health organization, who is on that cusp, on that precipice of, should we switch? Should we stay with our system? We've been with our system for maybe 10 years. And it's, as you were referencing, Tom, like it's good enough where like everybody's gotten used to it, but we know that it's also a problem that average note takes 5 to 10 minutes to complete. Clinicians are not happy with the deliverables. There's a 30% denial rate. So should we stay or should we go? So what advice would you give a clinical lead about knowing when it is time to switch?
I think the biggest thing is just, again, technology takes time to adapt. So why not get on something now early on so you can adapt and already be changed before the world really changes with everything. We look through things first from the patient perspective, and we've really adapted our processes for that patient perspective. The second is the referral sources and the doctors. And that's part of the journey where we fixed the patient notifications, trying to decrease no-show cancels. Now we're moving on to the referral sources. How does the things we send out to them present? And then the last is our clinicians. And that's kind of where we're at now in the journey process is how do we make things really customizable for them? So this whole process, patient has improved, referral sources perspective has improved, and now the clinician has improved. So I think as a clinic owner or director, that's the things. How can I help my patient success and my clinician success improve? And it's probably time to get on with that technology at this point.
Yeah, wonderful. Thank you for that. And Brady, the same question for you then. What advice would you give to an administrator who's looking through these systems? Maybe what are the top 3 points to look at when selecting these systems? To select a system that fits your mold based on some of the factors, like your economic factors, your geographic factors, your workforce factors. So what are some of the top three advice you would give to someone?
Top 3. I've never been good at listing top 3. So it's either one or many. But yeah, I would say it's, don't be afraid to make changes. Like, I mean, it's going to be hard, but also definitely do your research and make sure you're doing your, making the changes for the right reasons. But also, yeah, sometimes it's got to be hard, and don't be afraid to get your hands dirty and learn your processes and learn your company and learn about the employees and what they do on a daily basis. And I think that's pays its dividends, after you make changes.
Yeah, that's and that's the wonderful. I think that's again, knowing what you want, right, and knowing how to get there. Without any further ado, then, if you guys are ready, we have a question from the audience. So I think it's going to be a little bit early, but this question is for Brady, and it's from Nate. Nate is asking, Brady, I heard you mentioned in the webinar that it's been a journey of transformation for the past 10 to 15 years. In your view, what has been the most significant change during that time, and how did you navigate and overcome the challenge?
I'm not sure if this question is for me, since I think Tom mentioned the 15-year time period, or is it Nate? I guess, do you want to specify? Is this?
Well, until Nate is specifying, why don't we then ask Tom? Tom, you mentioned in the webinar that the journey of transformation. So, would you mind expanding a little bit on that transformation that you've seen over the time, and how did you navigate the change?
I think the biggest navigation, as we mentioned, was just open communication with everybody, be it initially navigating change with, just documenting, as I mentioned, paper charts to EMRs. But every clinician is different, and you have to support them differently, and know where they are upon that journey of the last 15 years. They've been through different EMR systems. And when you're first adapting one 10 years, 15 years ago, it's a new thing. So everybody's going to learn that system. And I think the challenge now comes is over this time, people have had 2, 3 systems before. So they're always comparing those systems to newer ones. And I think we've always tried to be ahead of technology, being it with patient care and modalities, things that a patient can really benefit from is always the key point in learning that journey and adapting. And I think if you're always keeping that patient perspective first, what can they benefit from? And the EMR system can benefit the patient experience, and then therefore the clinician experience. And then, when you have a good community word of mouth, we're in a small community. So if a patient has a bad experience filling out an outcome or doing something, or is a clinic way too long, or doesn't think the therapist, that word spreads, and that's our reputation. So of these 43 years, our reputation has been the number one thing over all that time that we've always tried to maintain.
Yeah,
I can give my best answer to that. Also, I guess I've been in around Westarm my whole life, but probably in this role specifically for about 6 or 7 years. So I don't know if I'm the best to give the 10 to 15 time span, but I think over this specific period, I think there's been I mean, dealing with the pandemic and the fallout of that, and continuous reimbursement cuts from Medicare and from uh, different payers. I think that has been probably the biggest challenge, that we're facing. Just even going back to 8 years ago, like I mean, I know the margins of the business margins were so much better. There wasn't as much of a um, increase of payroll for therapists and other staff, and reimbursements have gone down in general since then. So I mean, it's really just trying to be more efficient, and working with the patients that you do get, and expanding that patient base, and doing more with them. Um, and yeah, I'm getting people on board for that, because it's hard. It's a lot to ask for, a clinician to essentially see more patients, constantly. Like that's a big ask. So I think that's the biggest challenge is overall that we're facing, and I'm sure many other providers are facing.
yeah, absolutely, right. It's like it's being hit from every corner, and from every angle. And actually, that's like there's a next question from Eric Ricard. I recall Tom saying that technology needs to adapt. Reflecting on the evolution of EMR, how would you describe transformation from paper workflows to digital systems over the past 15 years?
Yeah, I think going from paper charts to EMRs, and then tying billing into those, that was always the challenge back then, is having be able to talk and communicate, where our office assistants were that bridge between that. And now with EMRs of the past, it still was always ended up coming to that billing aspect. And we want growth in PT. We want patients to not only show up for their first appointment, but also stay for their plan of care. And if we're losing business, or we're cutting units because clinicians don't have time to complete that direct care, then as a business, we're losing money. So I think that whole evolution is that EMR has to be the complement to your business to allow you to be able to deliver those services. Because honestly, that's all we get. That's how we get paid, is billing units and spending time with patients. And if we're not doing that, it's just lost revenue, lost time.
Yeah, absolutely. You have to be efficient, and you have to be effective, right? So there's a question from the audience. The PT world is exhausting, since uh, a lot of physical therapists are experiencing burnout. How does Westarm address burnout in the physical therapy world, and what do you do to motivate clinicians?
Barry, I'll let you take that since you're having a good tournament coming up here.
Oh yeah. I mean, I think just yeah, unfortunately, yeah. I mean, I don't have all the answers maybe, but we try to, yeah, we do have a softball, I'm sorry, not a pickleball event for our employees coming up soon. Um, I think maybe just creating a kind of sense of community, and having fun can help a little bit, and really just, I mean, at the end of the day, it's what does cause burnout. It's like doing notes too much, staying late, not having a personal, having a work-life balance, like, creating efficiencies that can help them to not have that happen, and I think with our EMR, like that's probably something that we looked at, and one of the main reasons why we, look towards different EMRs. So
Yeah.
yeah, we're yeah, Tom, go ahead.
we're small enough of a company where Brian, the owner, Brady, the vice president, door is always open. And I feel I could also be that communicator, that bridge between a staff concern that I heard of, uh, just having that pulse of the clinics, but really valuing our employees where they get lunches, they get time off. They don't have to worry about not having a vacation or time off. And that being because we have 7 clinics so close together where everybody kind of shares into it together. And I think that's the whole process of this EMR is we're all in it together. We're buying into it together and we're growing together, which presents a sense of community. But for somebody that's burning out, I mean, the leadership has to look at those opportunities and those challenges is of how do we grow and how do we change this? Because people are very appreciative when they see the end result then of, hey, I had this issue and now, it is fixed and we're actually better in the long run on it. So I think of all the challenges we go through, my goal is, do we end up better after that challenge? And does that help staff?
Yeah, that's wonderful, and I think I'm sure the staff hopefully understands and appreciates this because I think it's like it's not easy an easy world to navigate in, right? And it's not an easy world to work in with all the problems. But thank you for that. So we have a question here. Have you looked into addressing any new service? Oh, I'm sorry. Have you looked into adding any new services or revenue streams into your practice? And if so, what type of impact has it made?
Well, we have expanded our school-based therapy team. We've sought out new contracts with our local school districts, and I think we're up to 6 at this point. It is a nice supplement to our main business of outpatient physical therapy, but it at the end of the day, I mean, is a little bit more simple in terms of billing and collections. I mean, we bill the school districts for the hours that we treat in the schools, and you don't have to deal with insurance companies, and that's really nice to have a side source of revenue like that.
Yeah, in terms of clinical end, our goal was honestly always to put clinicians in a place where they want to succeed. So we had a clinician who was orthopedic. She wanted to get into women's health, and she developed that. We've developed lymphedema. We want to get into that a little bit more. And also looking at programs for Parkinson's patients, neurological, adapting to that. Because, sometimes rehab places around here are closing in terms of neurological. So looking where the patient's needs are. And sometimes those programs don't make additional revenue streams, but they bring people in. We have Parkinson's program where they also have like a gym membership and come in for group classes. And we probably don't make money, but it's a great service to the community, which then brings in, people and keeps your reputation up. So I think that's the thing, is always looking at technology or patient equipment or programs of how it can service the community, not just bring in additional revenue stream.
Wonderful. And I think we're going to close this webinar with there's less of a question and more of a statement from one of the webinar attendees. Change is difficult for many people, but is often necessary. Thank you for your words of wisdom. I really like grace regarding the company and the organization. So thank you, gentlemen, both for being open and honest. And thank you both for helping our industry, our organization, and helping your community along the way. I think it's palpable that you are true leaders in both the physical therapy world, but also in just the healthcare system in general. So thank you for leading, thank you for administrating, and thank you for leading to change. So appreciate it, and thank you for the last hour of being open to our rehab community. So thank you.
Thank you very much.
Yeah, thank you as well, Alex. Yeah, it was good to be on here.
Thanks, Alex.
Thank you, guys.